Welcome to Catalyst Medical Review. Today we'll be talking about scarlet fever. We will begin with the definition. Scarlet fever, also called scarlatina, is a moderate infectious disease that is caused by group A streptococcus, also known as Streptococcus pyogenes. The bacteria produces a toxin which is responsible for the rash. Group A strep lives in the nose and the throat and can easily spread to other people. The development of scarlet fever requires prior exposure to the bacteria. The presentation. These patients will present with red, sore throat, normally a fever in the range of 101 degrees Fahrenheit or higher. They may have whitish coating on the tongue. Early in the illness, they may also have a strawberry tongue with red, bumpy appearance. The skin may be red with rashes that may appear like a sandpaper and feel like a sandpaper. The glands in the neck may be swollen, and they may also have bright red skin in the creases of the underarm, elbow, and groin. Some patients may present with headache or body aches, and you may also have patients presenting with nausea, vomiting, or abdominal pain. The progression of the illness. In general, scarlet fever is a mild infection. It usually takes 2 to 5 days for someone exposed to group A strep to become ill. Illness usually begins with a fever and sore throat. 1 or 2 days after the illness begins, a rash usually appears. However, the rash can appear before the illness or up to 7 days later. The rash may first appear on the neck, underarm, and groin. Over time, the rash spreads over the body. The rash usually begins as small, flat blotches that slowly become fine bumps that feel like sandpaper. As the rash fades, the skin may peel, especially around the fingertips, toes, and groin. This peeling can last up to several weeks. The risk factors. Scarlet fever, like strep throat, is more common in children than adults. It is most common in children 5 through 15 years old. It is rare in children younger than 3 years old. Adults who are at increased risk for scarlet fever include those who are often in contact with school-age children, such as parents and teachers. Close contact with another person with scarlet fever is the most common risk factor for the illness. Infectious illnesses tend to spread wherever large groups of people gather together. Crowded conditions can increase the risk of getting a group A strep infection. These settings include schools, daycare centers, and military training facilities. The mode of transmission. Breathing in droplets is a very likely way for the spread of the disease. Touching something with droplets on it and then touching the mouth or nose is certainly a means of transmission. Drinking from the same glass or eating from the same plate as a sick person, touching sores on the skin caused by group A strep, such as impetigo, can all be means by which the disease spread. Rarely, people can spread group A strep through food that is not handled properly. The treatment. The treatment of scarlet fever is penicillin or amoxicillin. Here's a clinical pearl. It is important to remember that if the child has a sore throat and a rash, it may be scarlet fever. Well, as always, thank you for listening, and I do hope this short presentation has met your need in helping you prepare for your upcoming exam, and I wish you well.